We know the benefits of regular physical activity participation on mental and physical health, but those who stand to benefit the most are often the least likely to have access. So through this research, we wanted to co-design a safe and inclusive physical activity service for people from refugee and asylum-seeking backgrounds. Historically, research has been conducted for people rather than alongside the very people it's aiming to benefit. So there's a real problem here, and when you think about when researchers or policymakers say that programs don't work, often if we look at the reasons why, it's because we haven't actually asked communities what they want. So we spent over a year conducting one-on-one interviews and a series of workshops with people from refugee and asylum-seeking backgrounds, and also the people who provide services to them. So we had representatives from legal, employment and health-related supports. So we wanted to understand their experiences with physical activity programs and services, barriers and facilitators. And we did this over a lengthy 12-month period, which is really central to co-design and the principle that you move at the speed of trust. So many of the initial months were spent building relationships with the community, and then what we ended up with following the workshops were 6 guiding principles. The first guiding principle is cultural safety, where it's important that a person's identity, culture and their experience are acknowledged, welcomed and respected. And so part of this co-design process was working with people from refugee backgrounds and service providers together, and they came up with not only the 6 guiding principles but actions to address them. And so within cultural safety, some of the things that came up were around staff having the cultural capability to work with diverse groups, having women-only times and spaces, curtains on the windows, and also making sure that we respond to language barriers and using bicultural workers and bilingual workers to build trust, but also make sure that we're responding to those language barriers to accessing a traditional physical activity service. The second principle was emotional safety. So people want to feel understood and supported, which when we think about a commercial gym often isn't the case. And so people wanted us to be aware of their often traumatic pasts and still living experiences, and that our staff are well aware of how to respond if needed. To do this, services need to ensure that there are strong partnerships and referral pathways to existing mental health services, and that staff have all received mental health and trauma-informed training. Other strategies to create an emotionally safe facility are also around the environment, so ensuring we have colours, we have music, making people feel safe and included. The third principle is accessibility. So we need to be thinking about how do we identify and address traditional barriers to accessing services. And so a lot of the things that came up during the co-design process were around the cost of accessing physical activity services, the location and transport, how are people going to get there, and also helping to overcome barriers often facing women, including childcaring responsibilities. The fourth principle was support to access basic needs. So physical activity services need to be equipped to provide additional supports beyond just an exercise program, and this came up extensively, that people need support to access other basic needs. So people are often experiencing complex and overlapping stresses, so things like housing support, food support, and acknowledging that it doesn't need to be the physical activity service providing these additional supports, but being able to refer into programs that do. The fifth guiding principle is physical activity literacy, acknowledging the structural barriers to physical activity for people from refugee backgrounds. We need to make an effort to improve physical and health literacy. Participants wanted in-language information on the benefits of leisure time activity and to employ health professionals like exercise physiologists who can tailor activities to individuals' needs. Services should also work with community leaders and bicultural workers to improve the usage of exercise referral schemes. Also under physical activity literacy, it's important that we employ university qualified health professionals to deliver these programs, as they're able to tailor these exercise programs to people with complex needs. The sixth and final principle is social and community connection. People want to feel part of a community-based program which provides people with a sense of connectedness and prioritises joy in movement.